Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I am a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead, delivering OSCE training to NHS Trust. And I am sharing with you on my channel, hopefully lots of useful and accurate and up-to-date information to help you self-study and pass your OSCE, and also to ensure you're doing best practice for patient care and patient safety when you have got your PIN and your jobs. So today I am actually giving you a little glimpse of one of my practical videos. So I'm just sharing with you the actual A-E assessment part of the assessment station. So this is a real common area of fail, especially when I work with nurses who come to me for resit support. There's always issues in the A-E assessment, which has caused potentially a fail. And also a lot of the time they might have got the wrong information. And one of the most common mistakes in the assessment station is to separate your vital signs out from your A-E assessment and do them as two separate kind of procedures. But your vital signs form part of your A-E assessment and are really important to do that. So when we do A-E assessment, we follow the Resus Council guidelines, which clearly indicates that those vital signs are part of that A-E assessment. So that is best practice and what you should be doing. It's also really important because the A-E assessment is structured in a priority order. So if we've got an issue in breathing, for example, with our respiratory and our oxygen saturations, that is going to cause our patient to deteriorate faster than an issue in blood pressure. Very often when I teach resit students, they start their A-E assessment by putting the blood pressure cuff on first, and this is really not correct or safe practice. So we always want to start with assessing the airway, moving on to breathing, completing all our breathing, circulation, disability and exposure. So I'm going to share with you a little clip of that video. So you can see how that is done. It's also massively time saving for you in the assessment station. You've only got 20 minutes, which is not very long at all. So you definitely need to be doing the A-E assessment correctly in order to be able to have enough time to complete your holistic assessment as well. In this video, I'm obviously just using a mannequin. Remember, adult nursing students, you will have a patient actor, so you need to obviously communicate and interact with your patient actor, but also assess and report exactly what you find on that patient actor, not what you think they should be presenting for that condition. So that's sometimes a common question I get asked as well. So I'm going to start with airway. So Rose, you've been talking to me in sentences, so I know your airway is clear and there's no obstructions. So I'm going to move on to breathing. So I'm just going to get my equipment and then come back. I'm going to decontaminate my hands and grab my equipment to monitor. Okay, so my briefing's told me my equipment is clean and ready to use. So Rose, I'm going to move on to breathing. So I want to record your respiratory rate for 1 full minute, 60 seconds. If you can just not talk to me and just breathe as however feels natural for you, I'm just going to be quiet for a full minute. So I've got my fob watch and my 60 seconds starts now. Okay, my minute is up, and Rose, your respiratory rate was 25, which is a little bit elevated, but we know you've come in with shortness of breath due to your chronic heart failure. The rhythm was regular, but the depth was a little bit shallow. Whilst I was observing your respiratory rate, I couldn't hear any respiratory noises, such as coughing, wheeze, rattle or stridor. And I couldn't see any signs of respiratory distress, such as cyanosis, sweating, seesaw breathing. And I could see that there was equal air entry and both sides of your chest were rising and falling at the same. Now I'm going to move on and record the oxygen saturation levels. So Rose, I need to put this probe on your finger. Do you have a preference for which hand? Okay, thank you. So I'm just going to check your finger here, and I can see that it's clean, there's no nail varnish, and I'm happy to put the probe on. I'm going to turn that on and place it onto the thumb, and I'm just going to let that settle and read. I'm just going to jot down my respiratory rate of 25 and my oxygen saturations, which are 96%. Now I've completed breathing, and we're going to go on to circulation. So Rose, I'd like to record your pulse rate, your radial pulse rate, for a full 60 seconds again. Just need to place my fingers onto your wrists. Are you happy for me to do that? So again, I've got my fob watch. I'm going to feel and palpate the radial pulse. And my 60 seconds starts now. My 60 seconds has passed, and the pulse rate was 75, and the rhythm was regular, and the strength was a little bit weak. Now Rose, I'd like to record your blood pressure, so I need to put the blood pressure cuff onto your arm. Are you happy if I use this right arm? Have you had any surgery to this arm, or have you had any fistulas? No, okay, so I'm just going to check, and there's no cannula, and I'm happy that there's no soreness or wounds here, so I'm going to place the blood pressure cuff on. When we record an electronic blood pressure, we should make sure the arrow or the A on the blood pressure cuff aligns with the brachial artery. So we want to palpate the brachial artery on the inner aspect of the elbow. And we're going to place the cuff 2 to 3 centimetres above that. We ideally want the arm at heart level. So I'm going to connect this up, and this is just going to go tight onto your arm. Whilst this is circulating, and to help save time, I'm going to check the capillary refill and the perfusion on the other side. So, Rose, I just want to have a look at this hand, and I want to do your capillary refill. So I'm going to just push down on your finger for 5 seconds and look for the return of blood flow in less than 2. So 1, 2, 3, 4, 5. 1, 2, that's returned in normal time. And I can tell there's no, the hand is warm, there's no pallor, and there's good perfusion. So my blood pressure has finished now, and it's 101/60. So this is slightly low, but maybe in keeping with heart failure. So I'm just going to jot this down, and I'll be escalating all these observations. So I'm just going to take the blood pressure cuff off now. So I'm just going to take this off your arm, Rose. Well done, that's all finished. I'm going to put my equipment back. I'm just going to jot down my blood pressure reading now. And I've finished C, so I'm going to move on to D for disability. So Rose, I can see that you're alert, and I just need to check that you are not confused. So can you just tell me where you are again? That's right, in the emergency department. And can you just tell me your name and date of birth again? That's correct as well. And do you know what the date and time is? Yes, that's right. So I can confirm, examiner, that Rose is alert and not confused. Rose, I see from your notes that your urine output has been not as good as normal. So can you tell me the last time you went to the toilet? Okay, and how much did you roughly pass? Okay, so that is reduced. I see from your notes that you're normally on diuretics for your heart failure. So have you been taking those as normal? Okay, so I need to escalate that to doctors because we may need to increase those diuretics or provide alternative medication. And Rose, when I started the assessment, you weren't in any pain, but are you still pain-free at the moment? So on a scale of 0 being no pain and 10 being the worst pain you've ever experienced, where would you rate where you are? Okay, so your zeros, you've got no pain or discomfort at all. That's great. And last thing I want to know is, what is your blood glucose level? Okay, so your last blood glucose level was 7, so that's within normal limits, so I'm happy with that as well. And finally, I'm on to E for my exposure in my A2 assessment. So first off, I'm going to take Rose's temperature. So Rose, I'd just like to take your temperature with the infrared thermometer. I'm just going to place it just away from your forehead. I can see there's no hair and the skin is clean. Okay, so that is 36.8, which is normal. And Rose, on your body from head to toe, have you got any bruises, rashes, bleeding or any injuries at all? Okay, so just your swollen ankles, which has increased, which I'm aware of. So would you like me to position those up on a stool for you? Okay, we can do that. And I'm going to escalate this to the doctors as well. And the last part in exposure is I need to just confirm and check your past medical history. So I can see for your notes, Rose, that you've obviously got your heart failure and type 2 diabetes. Is there any other medical history that I need to be aware of? No, okay, thank you. So I've completed your A2 assessment. I'm going to document your observations on the NMC 2 policy, and then I'm going to come back and just ask you a few more detailed questions about your current health and social care. I hope that was helpful for you to see how you combine those vital signs within your A2 assessment. And that's definitely, if you're self-studying or about to take your OSCE, it's definitely the approach that you want to use. So I hope that's been useful for you.